Hi there, my name is Omar, I'm with Cressalon, and we make TraumaGel. TraumaGel is a single-use hemostatic device indicated for temporary external control of moderate to severe bleeding. TraumaGel is a 30 ml pre-filled syringe of a polymer hydrogel that is used very regularly to stop bleeds such as junctional hemorrhage, extremity hemorrhage, head trauma, and other large lacerations or cuts, scrapes, road rash that may result in moderate to severe bleeding. A bit of background on the product itself. The formulation is a very viscous, tan, and opaque gel. This gel has highly adhesive properties and really great cohesive strength. The purpose behind that is ensuring that the gel can be not only administered to complex wound geometries, but also can maintain a cohesive strength that does not allow for additional rebleeding to happen after being administered. TraumaGel comes as a syringe that requires no preparation as compared to things like standard of care, whether it's gauzes, sponges, and powders. TraumaGel can be used immediately out of its pouch, comes pre-filled, sterile, and immediately ready to use. The gel itself has a unique mechanism of action. It's a combination of positively and negatively charged polymers. These polymers actually in conjunction with one another, rapidly promote a natural and native clot to occur at the wound site where it's been treated. One of the negatively charged polymers actually acts a lot like collagen in that when you get a cut on your left arm and not your right, your blood knows to coagulate at the place where the collagen has been broken. So supplying this gel, which can act and seem a lot like collagen but in a plant-derived analog, it can promote a much faster endogenous clot to form in that space. We're very thrilled to be working with a broad swath of people, whether it's paramedics, first responders, military, ER doctors, and physicians on the regular use of TraumaGel, and I'm excited to get into how to use it.
I'm Thad Toronto, EMS 14-3.
Awesome. Nice to meet you, Thad, and I'm Omar from the Cressalon team. We're very excited to walk into the instructions for use on TraumaGel. So the first step in using TraumaGel is to retrieve one TraumaGel syringe from the TraumaGel pouch. Step 2. Place the TraumaGel syringe by the side and identify the source of bleeding. Dry the wound with gauze or suction and clear as much blood as possible from the wound site prior to application. While not a requirement, it is beneficial as a clinical best practice to remove as much blood as you can, but if you do not have gauze at your disposal, you can skip to the next step. When ready to use, unscrew the applicator cap, ensure there is no gauze at the wound site, and insert the applicator tip deep into the wound as close to the bleeding source as possible. Once inserted, firmly and quickly expel all contents into the wound. Once all material has been deployed, withdraw the applicator as quickly as possible. Step 4. Place gauze into the wound opening atop the applied TraumaGel. Apply moderate palm compression hand over hand, covering as much surface area as possible. Continue compression for 3 minutes or until hemostasis is achieved. Avoid ejecting any of the underlying TraumaGel. If some of it begins to eject, it means you are likely applying too much compression. Note, if needed, additional gauze or a pressure dressing may be applied to maintain pressure in the event that you cannot maintain 3 minutes of manual compression. So, assuming the patient has arrived at definitive care, and this is not likely to happen in a pre-hospital setting, one must remove the entire amount of TraumaGel prior to proceeding with repair of the wound. So, the first step is to soak the gauze over the TraumaGel with sterile saline or water and proceed to begin removing the entirety of the gel. After a few iterations of starting to remove it, if there are still remnants of gel within the wound, feel free to use additional saline lavage and/or suction if need be. A good thing to keep in mind is to go slowly and gently remove the gauze and TraumaGel from the wound site, and don't heavily debride or aggravate the wound during removal. It's important to lavage post-removal where applicable to flush the wound site of all residual material, and you cannot leave residual material at the wound site prior to wound repair successfully. For those who will be conducting repair, repair of the wound should happen following successful product removal, and TraumaGel should not be used as a sealant or for tissue approximation. And please make sure not to remove the gauze or gel before the patient has been stabilized and arrived at definitive care, and do verify that no rebleeding has happened post-application. Prior to administration of TraumaGel, do dry the wound with gauze as much as you can if gauze is available to you. In the event that you're prepared to use TraumaGel, do not leave any of the gauze used to dry the wound at the wound site at the time of TraumaGel administration. Do insert the syringe as deep as possible into the wound and firmly expel all of the contents quickly. Do not expel TraumaGel without direct contact to the wound, and do not expel only a partial quantity, as this may affect product performance. Once applied, with gauze over the wound, apply even palm over palm compression, measuring about 40 to 60 pounds of pressure. If you notice that TraumaGel is beginning to exude from the wound, you are likely applying too much compression. Do not use heavy, pointed, digital compression into the wound, as there is a risk of expulsion of TraumaGel from the wound site. Do maintain consistent pressure for 3 minutes or until hemorrhage control is achieved. Do not take your hands off of the wound during the compression window for the ideal clinical outcome. Do ensure you apply TraumaGel directly to the wound, and do not inject TraumaGel intravascularly due to risk of embolization.